Hi, this is Dr. Kang's Scuba Diving Stories, and today's story is about nasal septal deviation. A lot of people have this. Quite a number of questions on the website. Quite a number of phone calls that I get. And no wonder, because nasal septal deviation is something that so many people have. So this disease itself is not a disease. But when other disease comes along, like rhinitis, allergy, sinusitis, then doctors look into your nose and say, ooh, your septum is deviated. You should correct that, which is not really true. So today I will talk about nasal septal deviation. I will briefly cover the anatomy and cause of the deviation, symptom management, and the relationship to diving. So this is quite a picture showing straight septum, which is very rare in adult population. And this certainly is crooked, deviated nasal septum. What is this? Okay. Strange enough, adult population, only 5 to 10% of population is not deviated, which means only 1 out of 10 or 1 out of 20 had the straight septum. Most people have somehow, some degree deviated. About 50% of newborn, the nose is deviated. So, nasal septal deviation, this is not a disease. It's just a normal anatomical variation. And it is very prevalent in so many people. As you grow, somehow the septum will deviate because it cannot follow up with the growth of the body, and septum probably grows faster. So there is nowhere to go, and then it will go deviated. Nasal septal deviation somehow is very closely related to hypertrophic rhinitis. It has a very good reason. See this. This is inferior turbinate, middle and superior turbinates. This one, when deviated to that side, this one will touch this, and also there's a very small airspace, which means you have to somehow breathe harder to get the air in, and that will make your turbinate grow, and which make the whole situation worse. So cause of the deviation, it's usually congenital. You're born with it. Compression during birth, that's very possible, I know. Trauma when you're very young, and Marfan syndrome, genetic, you know what it is. They have 100% septal deviation. Symptoms, stuffy for sure. Nasal congestion, usually unilateral, which means when you sleep, if you sleep on the right side, your right nose is stuffed, and the other way around as well. That can give you recurrent sinus infection, nosebleed, and you have some problem with sleeping, and can give you snoring or even sleep apnea. Can give you headache and postnasal drip. This is not because of the septal deviation, but because of the disease that accompany the deviation. So management, there's quite a number of drugs that we can take, and there's quite a number of surgery as well, but probably it's beyond the scope of this presentation. Diving. When you have acute upper respiratory infection or cold symptoms, of course no diving. It's not about septal deviation, but it's about the related disease. Also, if you have any problem with equalizing, you should not dive. Nasal septal deviation itself is not a contraindication to diving. So don't really focus on this. You should focus on other nasal disease and symptoms that you have together with septal deviation. As long as you can equalize, you can dive. If you do any form of surgery in your nose, it is recommended that you take minimum of 4 or preferably 6 weeks after operation and begin diving. Again, minimum of 4 or 6, depending on what kind of treatment or surgical procedure you have done. But it takes minimum of 4 weeks for the whole nasal mucosa to heal up. So this was about the nasal septal deviation, anatomy, causes, symptoms. So once again, nasal septal deviation itself is not a disease, but it can cause other nasal disease, and when they are combined, that make the situation worse. About diving, as long as you can equalize, septal deviation doesn't really bother diving. And thank you very much, and I will come back soon. Thank you very much again.